We've been watching with the situation globally. I think there's 92,000 cases in 70 countries. In the United States now, I think it's about 60 cases. The number keeps changing, but are that are those that weren't on those chartered flights, and another 42 or something that were on the chartered flights. At this time, we do not have any confirmed COVID-19 cases in Dallas County, but we take this situation very seriously, and we are preparing for any possible response that may be needed.
And how are you preparing?
So we've actually been doing, right now we've been in a containment sort of phase. So we've been monitoring any persons that have been coming from China, where we follow up with them, monitor them for any fever or development of symptoms until they're past the incubation period. We follow up where others that might be, we're working with healthcare providers, we're disseminating the latest recommendations for testing, making sure those are implemented properly. We're disseminating CDC's recommendations for those. We're working with schools, businesses, other settings to make sure, right now, again, we're in the containment phase, but we want people to be thinking, okay, if we move to that other mitigation phase, what are the plans? What plans do you have in place? Look at them again, update them if needed. So, if we did have to close schools, how would you, handle that? What sort of learning, distance learning type of things, what sort of teleworking things are in place? What sort of leave policies do you have so that people can stay home if they're sick? But the other message is, the general message is the best prevention that we can still do, is what's the same prevention for the flu. Wash your hands, don't touch your eyes, nose, and mouth, cough or sneeze into your sleeve. If you're sick, stay home, and then, regularly clean the surfaces that are touched frequently. In prior episode with Ebola, Dallas was at the forefront, was the first city. For this one, there's more activity on the West Coast going on, so we're watching them, we're learning from them. That's what we were learning from some of these other countries, seeing what's going on. But we don't have any cases right now, but we need to prepare for whatever possible response may be needed. It's not a time to panic, it is a time to prepare. We just today added the capacity to be able to test for the COVID-19 locally in our lab. So, prior to this, we've been having to send all of the specimens to CDC. Now, we still have limited capacity at this point. We are adding to that. We actually just went through an emergency purchase for some additional laboratory equipment that can automate some of that, so it can increase our capacity as we're moving forward. I think even we were the first to have it in Texas, that capacity, although, others are getting online also. Well, the turnaround from, these specimens had to be FedExed over there. They'd run them. There was some, initially a backlog. The CDC was getting faster on that. Now we will be able to turn them around, within a day, to get some of those specimens done. But again, we have limited capacity, so we're still implementing CDC recommendations at this point in terms of who's getting tested. So there's the personal protection and prevention measures, but then also to be looking and thinking through what are you going to do if the schools close? How are you going to take care of your, child care, some of those issues. The schools are looking at that. We've been meeting with some of the superintendents and other school staff, and we have ongoing work with the schools, with businesses. We're, trying to get people to look at their continuity of operations plans, their leave policies, to make sure that if people are ill, they're not discouraged from staying home. We want people who are ill to be able to stay home, and, other environmental cleanup processes, what's their process for cleaning the surfaces that are frequently touched. All of these are just part of the preparations that people need to really look at and think through. If this happens, what will we do? One of the things has been the masks. And the Surgeon General just came out with a statement, I think, in the last couple of days, just really clarifying. You don't need to be walking around if you have infection. You don't need to be walking around with these masks. It really hasn't been shown to protect you. It's more if now someone is ill, or has COVID-19, then putting the mask on that kind of person will prevent their spread. When they cough or sneeze, the droplets prevent that spread. Also, if someone is caring for someone who's ill, then in that situation, the mask can help. That's why, also in hospital settings, they use these protections. But just walking around in the community, that has not been shown to be helpful. It's not a time to panic, but it is a time to be prepared and to really seriously look and think through if these, some of the, again, schools were closed, if you needed to telework, or if what were the realities of implementing that. The other thing, it's not a time to go and buy everything off the store shelves. You may, when you go shopping, buy a few extra things. You want to be able to be, so that you can minimize having to go to the store, over a couple of weeks, but you don't have to buy everything off the shelf. That's not going to help. Well, yeah, we are, like in daily conference calls with the state, the CDC. That's a point really want to emphasize. There is tremendous, please check our website, the DCHHS website, also the State Health Department, and CDC has fantastic resources on their website with specific guidance for various settings, the business settings, the schools. There's just so much helpful information on that.